The ability to make a thin blood smear is an essential skill for medical laboratory scientists. This video will demonstrate how to make a smear. Well-prepared blood smears allow laboratorians to effectively examine a patient's blood for abnormalities which may indicate disease states or chronic conditions. So it is critical that the smear is prepared correctly to ensure an accurate reflection of a patient's current health condition. The specimen of choice for making a blood smear is one that is anticoagulated by EDTA. EDTA stands for ethylene diamine tetraacetic acid, and the tubes that utilize it have a lavender stopper. This anticoagulant is the preferred anticoagulant because it preserves red and white blood cell morphology. Prior to making a slide, the sample must be gently mixed to make sure there will be an even distribution of cells on the smear. You don't want too much plasma or too many cells. You will need clean glass slides to make a smear, one for the smear and the other to push the blood. The slides must be clean or the blood may not evenly distribute across the slide. After mixing the blood, use a capillary tube to transfer some blood from the tube and put a small dot on the glass slide. This dot will be approximately 2 to 3 millimeters in diameter. If you get too small of a drop, the smear will be too short and can dry out before you make the slide. If the drop is too big, your smear may be too long and will go off the end of the slide. Alternately, you can use a wooden stick to make the dot. If there isn't a lot of blood in the tube, the wooden stick doesn't work very well, but with a full tube of blood, it works very well. After putting the drop on the slide, use the other slide to push the blood into a smear. The second slide is placed at approximately a 25-degree angle. Place the edge of the pusher slide on the slide with a drop on it, and pull the upper slide back into the drop of blood on the bottom slide until the drop starts to spread along the edge of the slide. Smoothly push the slider across the surface of the other slide to the end while maintaining even light pressure. If performed correctly, your smear should cover about 2/3 of the length of the slide, have a feathered edge, and be free of bubbles or ridges. The edge may be straight or slightly curved.